I would say there is a growing awareness of cancers, not just amongst, I would say, the healthcare professionals, but also communities. And this has been largely due to the grassroots advocacy that has been ongoing. If we look at, for instance, what used to happen 10, 15 years ago, at least in Kenya where I practice, if you looked at the obituaries, you would sort of have, people would mention you've died from a long illness or short illness that never really get into, because there's still a lot of stigma attached to that. But as a result of advocacy, people, champions who are literally coming out and saying, listen, I had my cancer, it was picked up early, I'm surviving, I'm moving on with my life. We've really tried to, and those testimonials have been incredibly powerful in changing the public perception. But public perception is one thing. There does need to be, again, deliberate government investment in trying to improve these services. And so as in Kenya, we've been incredibly fortunate to have a government that's been very keen and interested in terms of providing policy. I say we were probably one of the richest countries in policy, in cancer policy. And there have been several efforts by our National Cancer Control Program to come up with not only treatment guidelines, screening guidelines, specimen handling guidelines, really trying to look at the entire continuum of care from all the way through from prevention to survivorship. But then again, there does need to be funding. And what's happened is that our National Hospital Insurance Fund has really started to support some of the costs of cancer care. And it's not perfect, but it's definitely helped to make a difference. I would say when I was an intern, and what happened was, because again, we didn't have as many oncologists at the time, the internal medicine physician would prescribe chemotherapy, which would then administer as interns to the patients. And what you would find was you would give the patient perhaps the first cycle of chemotherapy, and then the patient would disappear, and you're wondering what's going on, you're trying to call them and that kind of thing. And then you find 6 months later they're coming back and they're like really excited, Anna, because they're like, doc, we've raised enough money for the next cycle. And so those are really the sort of heartbreaking stories that were pretty commonplace. But just over the last 10 years, we're definitely able to get more patients to the finishing line in terms of receiving all the treatments that they require, whether it's surgery, whether it's radiotherapy, whether it's chemotherapy. And I think this has gone a long way in terms of changing the overall perception around cancers, and also the long-term outcomes for patients. I think one of the things we haven't done as well is really trying to think through investments and support for the financial aspects of cancer care. We've had a few efforts, but there hasn't been deliberate funding in terms of trying to look at what are the models or innovative structures or strategies that we can use to ensure that patients actually avoid or mitigate financial toxicity or catastrophic health expenditure. So in terms of looking at what can we do right, what we do know, for instance, when we talk about pricing, is we're paying 3 to 4 times a similar drug than in Africa, in sub-Saharan Africa, than in an equivalent low and middle income country. So why aren't we doing more to advocate for that? So in thinking about pricing, it's going beyond one, how do we think more about regional access, and how do we then, work with collaborators in the region to think about how can we drop the price point for our patients collectively, but also thinking through what are some of the strategies that we could employ in order to improve funding for cancer care. And this really involves coming up with multi-stakeholder, multi-sectoral ideas around this. And perhaps we do need to think about, how do I invest the limited funds that I'm getting from the, say, National Hospital Fund, and maybe using, some of the proceeds or dividends to that, and dedicating those. And rather than thinking we're going to put these in a kitty, or have, taxes. So it's really thinking outside the box, getting the finance team, getting the educationists, getting everybody on board to think about how are we changing narratives. We talk about signs and symptoms of, early prevention, but how do we then educate the public? And that's where we need the teachers, that's where we need the educators in order to talk about, how to eat healthy, how to live well. How do we get, the researchers to look at, the variability and trends that we're seeing in our population. So it's really around how do we get each of the team to come together and think through how are we going to work collectively to solve our problems. I think for the longest time there has been a reliance on, somebody else will, come and solve the problem for us. I think there's a growing recognition that we do need to sit down together and figure out our problems, and definitely get collaborators to help support that. But we have to be the driver in trying to sort out the concerns for our populations. So I think what we really need to do is really think about patient-centric approaches, and it's really trying to look at the patient journey all the way through from, lady feels a breast lump, for instance, and then looking at what are the bits and pieces that we need to do in order for her to, one, get to the hospital, have a diagnosis. What are the diagnostic modalities? Do we have pathology? Do we have imaging? And then think through, yes, now that we have a diagnosis, then how do we put her through to treatments, whether it's surgery, whether it's radiotherapy, whether it's chemotherapy, and then thinking through how do we then, progress her to survivorship. And all through that journey, what are the different aspects of care that are needed, the skill sets and the workforce that are actually required to provide these services, and sort of really approaching that through a 360 manner where the patient always at the center will help us to really think critically around how our health systems are actually benefiting our patients. And I mean, we've for the longest time sort of thought about health as expenditure, but we really need to think about health from a different perspective as health investments. Investing early in investing the early detection and timely appropriate treatment for our patients means healthier citizens living longer, being more productive, and that is a win for the economy. And so as governments start to realize that it's not actually health expenditure, it's health investment. It's really shifting our mindset and really keeping a patient-centric focus that will ultimately achieve better health outcomes for our general populations at large.